Hello and welcome back. This is Nurse Eunice with Florida Training Academy, and we are going to be discussing basic medication training. What are the different classifications of medications? How can you prevent medication errors? And the reason that this is so important is because so many of my viewers, wasn't expecting for that to happen. So many of my viewers are interested in actually pursuing or advancing their careers and going into from CNA to med tech or med aide. The word that we're going to use in this video is going to be called medication administration provider or MAP. That's a term that we use here in Florida, but every state has a different term. But regardless, if you're working in an assisted living facility or a nursing home, usually if you have at least 1 year of experience as a CNA, you can more than likely become a med aide and help passing medications to patients safely if you attend a training course. So this is just to help supplement the course that you would take so that you can pass your certification examination on the first attempt. And we'll get started shortly. All right, so the basic medication administration training course, of course, this is Eunice Mathis with Florida Training Academy. I welcome you here. We're going to review some of the common medications, so we'll do a quick overview. We have cardiovascular medications that can be used to treat heart and blood vessel conditions. In addition to that, we have skin medications that can treat various skin conditions and symptoms. We have respiratory system medications. They can treat symptoms in the nose, the sinuses, and lungs. And there are other medications that we will discuss that treat other symptoms, such as medications for the urinary system, gastrointestinal, endocrine, and also the nervous systems. So with your cardiovascular medications, there are medications that are called vasodilators. So when you think of a vasodilator, that would be a medication that's used to treat chest pain or angina. And then there are also medications that treat high blood pressure. This is important because when you're giving someone a heart pill, you need to know what type of pill you are giving them. Are you giving them something that's going to be lowering your blood pressure or lowering their blood pressure? And if the answer is yes, well, that means that can cause dizziness. So as a medication aide, as a medication administration provider, even though you're not a nurse, you are still responsible for safely passing medications and knowing what medications you are passing. Another type of cardiovascular medication is a diuretic. A diuretic removes salt in water, so it's going to make them diurese. It's going to make them urinate more. And so a diuretic can be used to treat high blood pressure and also heart failure. If the heart is failing, it can't pump those excess fluids. So the way we're going to get that excess fluid out of their body is by allowing the patient to remove it, to void, to go to the bathroom more frequently. Antihypertensives are just that. They are medications which lower the blood pressure. And then we have antiarrhythmics. So let's say a patient has atrial fibrillation, which is an irregular heartbeat. You'll know whenever you feel their pulse, it's going to be irregular. Well, that irregular heartbeat can cause blood to clot, and it puts the patient at an increased risk of strokes. So antiarrhythmics try to put the heart back into a normal rhythm, or at least slow down the rate of the heart so that the patient will have less cardiac symptoms. Our respiratory system medications include antitussives. Those are cough suppressants. Expectorants. Those are medications that break up thick mucus in the lungs and bronchi. It allows it to thin the mucus so the patient can cough it up. So sometimes your patient's going to be asking for a cough suppressant while saying, oh, I feel like my chest is full of cold. Well, they don't need a cough suppressant. They need an expectorant. They need to bring that up, not suppress the cough. There are also decongestants and antihistamines. Those reduce swelling in the nose lining. They dry up mucous membranes. And also your bronchodilators. They are used to relax and expand airway passages. And common bronchodilators are your nebulizers and also your metered dose inhalers or your asthma pumps. Medications for the skin. Those include protectives and astringents. So when you think of astringent, a common one would be like witch hazel, but they can cover, cool, dry, or soothe inflamed areas. Our antipyretics, those relieve itching from allergies, skin conditions, and insect bites. We also have anti-inflammatory medications for the skin. They relieve itching and suppress the body's reactions to irritation. And then our anti-infectives, aka our antibiotics or our antifungals. They kill or inhibit growth of microorganisms that cause skin infections. And so, another type of medication that you'd be given as a medication aid would be medications for the urinary system. And so, when you think of the urinary system, a lot of you all just think about the urinary tract. Well, the urinary system consists of more than a urinary tract. So, antibiotics would be used to treat the urinary tract, the kidneys, the bladder, because remember that infection can travel upward. And so it can be a very severe, instead of it being a urinary tract infection, it can actually lead to kidney infections. We also have diuretics. So if someone has a kidney issue or a urinary issue, sometimes they don't produce enough urine. So a diuretic, yes, it can be used for somebody who has heart failure, but it can also be used for those who have kidney issues because it increases the output of water and salt, thus helping them to maintain normal urine production. And then analgesics. Whenever you see that word, that means some type of pain relief. So an analgesic, if someone is having severe UTI pain, the doctor may order a medication that will help relieve the pain from the urinary tract infection. And some of those medications can change the color of urine. So you reading those leaflets, the information about the medication you're giving your patient is so important. Our gastrointestinal system medications, or GI system for short, those can be anticholinergics and antispasmodics. So when you think of an anticholinergic, think of something that dries things up. And an antispasmodic, that means the person's having spasms and we need to give them something to counter those spasms. So those medications treat ulcers and irritable bowel syndrome by reducing stomach acid production and calming the muscle spasms. Now, this image shows an inflamed GI lining. So anti-inflammatories would treat conditions such as colitis, and it treats it by reducing the inflammation in the intestinal lining. But if you're giving someone an anti-inflammatory and they go back and they eat Takis or something that's going to irritate their stomach lining, well, the medications alone, they're not going to do their job if what you're feeding the patient or what you're allowing the patient to eat and not reminding them of their condition is going to counter the effects. So remember that medication plays a small part. That's why you need to be a CNA in order for you to be a med aid, because there's more that comes into play, such as dietary restrictions. And then we have our gastrointestinal stimulants. They speed up the transit of food, and they help to relieve nausea and promote gastric emptying through improved digestive motility. So think of it as something that will probably help them to have a bowel movement. That would be a gastrointestinal stimulant. Our endocrine system medications. So we do have our oral anti-diabetic medications such as glyburide and metformin. They do control blood sugar levels. Remember, whenever you have a diabetic that you're taking care of, you want to make sure that their food comes at the same time. We don't need much variation, because if you're giving them an oral anti-diabetic medication, some of those medications can work over a 12 to 24-hour period, and we don't want them to go too long without having food. So you will be checking their blood sugars, but in addition to, or having the aide, another CNA, check the blood sugar. But in addition to that, make sure that they have regular meal times and that they actually eat their food. As a medication aid or a medication administration provider, you are not allowed to give injectable medication. So you would not be giving any insulin. However, that doesn't mean that you won't be responsible for caring for that particular patient. You would just have to notify the nurse whenever the insulin is given. So an injectable or anti-diabetic agent, they also lower blood sugar levels, and they come in different types of versions. So there's rapid acting insulin, intermediate acting insulin, and also long acting insulin. Again, that would not be your responsibility, but you would still be responsible for monitoring that patient before and after the nurse administered the insulin. Hormonal drugs, yes, the endocrine system actually regulates hormones. So if a person has, let's say they have condition with their thyroid. Well, then whenever you're giving them their medication for their thyroid, you would be helping with their endocrine system. So the hormonal drugs, they treat problems with thyroid, pituitary, adrenals, pancreas, ovaries, and testes. So if a person has a problem, maybe they're going through menopause, you may be giving them their hormonal treatment. Nervous system medications. So if a patient has epilepsy, you would be giving them an anticonvulsant. So even though they may not have had a seizure while they were in your care, the reason why they're not having that seizure is because they have a regimen. They take their anticonvulsants, which prevent the convulsions. So they treat seizure disorders and other conditions. We have Parkinson's medications. They treat or reduce the essential tremor and other medications in your patients with, or other symptoms, of your patient who have Parkinson's disease, such as that shuffling gait. So you give them their medication in the mornings, and then by midday, they're walking better, they're able to speak better. But as that medication wears off, they begin their shuffling walk again. And so you will see that transition throughout the day. Our psychiatric medications, they could be antidepressants, anti-anxiety medications, antipsychotics, and also mood stabilizing medications. And a lot of those have side effects. So when you're given a medication as a med aide, you're just not a pill pusher. You really have to take this job seriously so that you can understand and notify the nurse if something goes wrong with your patient. So let's talk about the side effects of medications. A side effect is the body's reaction to a medication, which is different from the reaction the healthcare provider intended. So side effects can be mild to moderate. Mild to moderate is bothersome, but can be relieved without other problems. For example, if you take an antibiotic and it literally says to take with food, but you take it without food, well, a side effect is going to be GI distress. You're going to feel nauseated. There are also some serious side effects to medications. They can be called commonly adverse reactions. So let's say that if you take too much Motrin, well, you can hemorrhage, you can bleed. So that would be a serious side effect. So if your patient's taking Motrin and you see that their stool is now dark, or whenever they brush their teeth, their gums are bleeding, that should alert you that, wow, something's going on. There's a side effect. Something's happening with their medications. And then our severe allergic reactions, those can be life-threatening. And whenever we have a life-threatening emergency, we call that anaphylaxis. So let's just go back through our allergic reactions. We have those mild reactions: runny nose, sneezing, itch, or a rash, pretty much localized. They can become nauseated, they can vomit, they can also start having diarrhea. Whenever it's severe anaphylactic shock, that's when the skin can become flushed. They have rashes, itchiness, tingling in the lips and tongue, a racing heart rate, dizziness, swelling of the tongue, lips, and throat, difficulty breathing, and they can actually collapse. Okay. And so that's when you'd be doing the hey, are you okay? And trying to figure out if you're about to start CPR. So as a medication aid provider, you have to be mindful of allergic reactions. Did you check the patient's allergies before you gave them medication? And if not, you would be causing the patient harm. Now, this is something that, even though we said you can't give injectables, there is usually, if you're outside of a hospital, there is an exclusion. The one injectable you can give is that if someone has an EpiPen prescribed, if you're a first aid provider, you can give epinephrine. They teach that in first aid classes. So use an EpiPen if ordered and available, and always call 911, because one EpiPen may not be enough. The patient may need additional doses of epinephrine, and more than likely, whenever those advanced providers come, they're not using the EpiPen. They're starting the IV and they're pushing the epinephrine intravenously. So MAPS, or medication aid, may use an EpiPen even though it's an injectable, because that is an emergency drug. If a client has a severe allergy, the EpiPen should go wherever they go. For some of you all who will be working in assisted living facilities and group homes, maybe you're having an outing that day and you have a client who has a severe allergy. Well, they can't go without their emergency inhalers if they have asthma, and they definitely should not go without their EpiPen, because if there's an emergency, you need to be able to act fast. So medication errors are any preventable event that may cause or lead to inappropriate medication use or a patient harm while the medication is in the control of the healthcare professional, patient, or consumer. And that is from the National Coordinating Council for Medication Error Reporting and Prevention. Common kinds of medication errors include wrong medication, wrong dose, and missed interactions. So let's go back to wrong medication. That would be when prescribing or administering incorrect medications to patients. Wrong dose is when you gave the incorrect amount of medication, whether it was too much or too little, both of which could be dangerous. And then missed interactions would be failing to recognize dangerous drug interactions between medications. These errors can cause serious consequences for patients, leading to adverse reactions, worsening of their condition, or even death. Healthcare professionals must be vigilant to prevent these mistakes. All right, so we also have prescribing errors, and prescribing errors could be the wrong dose, the wrong drug, or the wrong route. So that is what happened before you ever even before you have the medication in your hand. The actual prescriber, the doctor, wrote the wrong order. So that's why when you get a new order, you're always supposed to let your nurse know, because that nurse is going to know, well, hey, this patient doesn't have these symptoms, the patient doesn't have this condition. I don't know why this medication is ordered. She would then go back and contact that prescribing physician and make sure they wrote the right medication order for the right patient. Also, using abbreviations can cause medical errors. So that's why even though we teach you about medical abbreviations, they should never appear on your record, as far as like your MAR, your medication administration record, because you may misinterpret something. So QD, QID, QOD, every day, 4 times a day, every other day, those can actually become quite confusing. So what we need you to do instead is to write it out without abbreviations so that there will be no misinterpretation. Illegible handwriting. So in the doctors, that's why a lot of charting right now is electronic, because it's kind of hard to read the doctor's handwriting. 0.25 could be, 25 milligrams if we don't see the point. So it's very important that if you don't understand something, you say something. You notify the nurse or you notify that prescribing physician. And then, as we mentioned earlier, don't forget about those missed allergies. And so you're always mindful. My patient has an allergy to strawberries. My patient has an allergy to penicillin. So if you see an order come across where a patient who has an allergy listed, the doctor missed the allergy. They can sometimes order medications that patients are allergic to. So it's going to be up to you to go back and just review that, because your prescribers make errors also, and you have to catch those as a medication aide. Dispensing error. So yes, the pharmacy can also make a mistake too. So being a med aide, it's kind of like being a mini nurse. You have a lot of responsibilities, which is why they also pay you more. But did you know that you'd be responsible if the prescribing doctor wrote the wrong order, if the pharmacist dispensed the wrong medication and you didn't catch it and something happened to that patient? You and that nurse would still be ultimately responsible. So the pharmacy dispensing medications, it is estimated that 14% of medications are dispensed incorrectly. So if a patient's questioning, why does a pill look differently than it looked last week? You need to take heed and you need to be asking those questions. Contact the pharmacy. On the leaflets, the medication leaflets, they will actually have what the medication is supposed to look like and the color. But communication is key. When in doubt, don't be afraid to notify that nurse, who will then pick up the phone and notify the pharmacy if you don't feel comfortable doing so, or if your facility's policy does not allow you to do so. Administration errors. I need for you as a medication aide to stay alert. You must remain vigilant and focused when handling medications. Catch the errors. You are responsible for catching errors made by others in the medication process, and then prevent mistakes. The final opportunity to prevent errors rests in your hands during administration. All right. And so, why are we taking medication administration so seriously? Why can't you just pass a pill? I heard a CNA tell me once, well, they get paid $25 an hour to be a med aide, and all I'm doing is passing out blood pressure medication. And it took me aback. I was like, oh my God, you're doing way more than passing out blood pressure medications. You are passing out medications to people who have chronic illnesses who you need to monitor as you're giving the blood pressure medicines to them. So just don't think that you're a pill pusher. You are a first line healthcare professional. You're giving these medications, and what you do or what you don't do can actually cause your patients to become more sick, or you can cause death. So what is the range of harm? Medication errors can start with mild interactions like rashes, but can escalate to severe life-threatening conditions such as anaphylaxis. Single incident impact. A single medication error can have serious consequences. It only takes one incident to cause significant harm. Consequences of medication errors. A major consequence is that the treatment is not effective and the condition of the medication is meant to treat does not get better, or it gets worse. For example, Jacob has been taking Depakote 500 milligrams, 2 tablets by mouth twice a day for seizures. Recently, his dose was increased to 3 tablets twice per day. An error in the MAR reduced his dose to half, leading to a serious seizure and a prolonged hospitalization. He ended up aspirating, you all. So when he seized, he vomited. Some of the vomitus went into his lungs. He ended up being intubated and in the hospital for 3 months, including a rehabilitation period, all because of a medication error. He did not have to have that seizure. So you need to make sure whenever you are transcribing a new order to the actual MAR, the medication administration record, if you're not sure, if you're uncomfortable, let a nurse know. The best caregiver is one who is not afraid to ask questions so that they can help prevent errors or medication errors with their patients. So common causes of medication errors, you're doing stuff in the dark. Why? Increase your lighting. So number one is poor lighting. Preparing or giving medication in inadequate lighting is unsafe. Number two, distractions. You TikTok generationers, talking, using phones, watching TV while preparing medications is a no-no. You have to limit your distractions. Don't try to have a full conversation with the patient and his or her family while you are giving the pills. Let them know, well, just for a few moments, I just want to focus on the medications and what I'm giving you, and then we can have that conversation in a few moments. Multitasking. Preparing medications for multiple patients at once is a no-go. It is one patient at a time. You will not have 5 cups and put like room numbers on the cups, because if the cups fall over, all the medications have mixed together. So you do not multitask and prepare multiple medications. You prepare medications for one person, take it to that person, document their acceptance, their refusal, the interactions, and then once your documentation is complete, then you go to the next patient. You will have to become familiar with your patient's medications. And I know starting off, this is going to be a little bit hard, but if you just study a little bit more, you're going to make your life easier. So unfamiliarity or not knowing the clients well is also a cause of medication errors. And the fifth one I would add would be not listening to your patients. If you don't listen to your patients and you think you know it all, you're going to miss out on important information. She may tell you that, hey, my doctor changed this medication. And you're like, no, he didn't. Take a moment, breathe. Your patient may actually be right. And look at the chart, because maybe the doctor told her something that he hadn't yet entered into the system, or that you hadn't yet checked because you were so busy with your other patients. So make sure that you actually listen to your patients to help prevent these medication errors. Focus during medication administration. Look at this busy med aide. So no phone, no TV. Don't try to be multitasking if you're in an ALF or something, or you're in a patient's home. You're not trying to do their laundry. You're not trying to fix their meals. And then again, no Wi-Fi. So focus on the medications when you are passing your meds. And this is hard to see. I do apologize, but it goes through the 7. And now, yesterday we watched a video, I think it's at the 6. I told you there are multiple, but the rights of medication. So here we have the right client, the right reason, the right medication, the right dose, the right time, the right route, and the right documentation. So I'm going to repeat that. It's the right client, the right reason, the right medication, the right dose at the right time via the right route, and then make sure that you actually put the right documentation afterwards. And you can always refer back to the slide and take a photo of it later. All right, so here we have some other information. So if you're given a medication for the incorrect purpose, such as maybe we have an order for Tylenol, but the Tylenol is ordered for pain, and you notice that the patient has a fever and you give the Tylenol for fever. Well, that's not acceptable. That is the incorrect purpose. You would literally have to call a provider back, let him know this patient has a fever. I think that would be extremely important, and then get more orders. Maybe we're going to get an order for a urine specimen, a sputum specimen, and then maybe orders for antibiotics. And now you get a supplemental order for which you can now give the Tylenol, not just for pain, but you can also give it for a temperature greater than 101. So it has to be very specific. If you give a medication without prescription, even if it's an over-the-counter, that's also a medication error, because giving a medication for which there is no current prescription is against protocol. And then an unordered dose. So if you decide just to give them an extra dose of medication because you just have it there, that's also a medication error. So be very careful. Take your job seriously. All right, so medication error, wrong dose. Are you giving the incorrect amount? Are you giving more orders than were ordered? The main cause of this is not immediately documenting on the MAR when you give medication. So make sure you document in real time. All right, so medication error, wrong person. Giving medication to one client that is prescribed or ordered for given medication prescribed for one client, but you're giving it to the wrong person, that is a medication error. So common causes, again, distraction, client awareness. Be alert for clients trying to grab medications belonging to others. Some people are actually, you're going to have two types of patients: the patient who wants no medications and the patients who want all the medications. And usually it's the good stuff, it's the pain medicine. So you have to be aware of your clients. And I hate to use the term drug seeking because we don't want to talk about our patients in that manner, but there are some patients you need to be more aware of, because they are trying to see if they're going to catch you slipping. And if they can get 2 Ativans out of you, or 2 morphines out of you, because you're not documenting, you're not paying attention, you're going to cause medication errors. All right, and so what if you don't check the identification? You have to know your client. If you are unfamiliar with your clients, a lot of your facilities are going to have a picture on the MAR that, again, is the medication administration record. And for those who did not watch our first video, medication administration providers and or med aides, they usually do not work in hospitals. They work in long-term care facilities. They work in group homes. They may work in assisted living facilities. They work in places that don't have enough nurses. So they are assisting the nurse who's out doing the wound care, etc., and the more advanced treatments. They're assisting the nurse by giving out medications, but they are limited in the medications that they can give. And so if you don't know the client, you're going to look at the medication administration record. It's going to have a picture of the patient. And then when you get through looking at that picture, I need for you to check your patient identifiers. You never go to a patient and say, hey, is your name Lucille? Because she's going to say yes, because she may be confused. So your patient identifiers can include the client's name and date of birth. Those are the 2 main identifiers. And then if they have an armband, you can also look at the medication record number. Additionally, verify information verbally with the client to ensure accuracy and prevent wrong person errors. All right, so the wrong route. Oh my, could you imagine 40 years from now, you need care, and that young, wonderful, very ambitious medication aide put an eardrop in your eye. Yeah, I couldn't imagine that either. So remember that ear medications and eye medications, they come in those little teeny tiny bottles and the labels are small. I need for you to read those labels to make sure you're putting the right medication in the right area where it's supposed to be administered. So a common medication error is when you put eardrops in someone's eye. So John is ordered antibiotic eardrops, and you put the medication in his eye. And so now he's saying his eye is burning, is irritated. What do you do? Oral to gastric tube. So leafless medications are ordered to be given orally, crushed in pudding. You dissolve the medication mixture in water and give them through her gastric tube. For a lot of medication aid providers or med aids, you're not allowed to give enteral medications through a gastric tube, not without more training. And so every state varies. If you don't understand the rules, you're going to contact the Board of Nursing, find a med aid program in your area. But again, usually you have to be a CNA for 1 year before you can apply to become a medication aid. If you give the medicine at the wrong time, you are also committing a medication error. So you have to make sure that the times match. Match the time on the MAR with the time on the medication label. Usually your MAR, especially if it's printed by a pharmacy, it will have those times. So if a medication is due twice a day, it's going to say 9 a.m. or 0900 and then 9 p.m. or 2100. So if you don't know military time, you're going to have to learn it in the medical field. AM, PM, be very careful. If your medications are labeled in the AM, you give them in the morning. If it's labeled in the PM, you give them in the evening. And then your time window. Your medications have a time window. A medication may be given 1 hour before the time on the MAR, up to 1 hour after that time, and yet still be on time. Sometimes your antibiotics, especially if we're going to be drawing peaks and troughs, which are levels to make sure the medication is therapeutic, that may be a little bit different, where you don't want to be an hour late, because if lab is coming an hour afterwards to draw the peak, well, then you have messed up that lab. So you want to be very careful. Medication error. If a medication is not given, you still have to document it. So if a medication is not given due to client refusal, that isn't necessarily medication error, but it must still be documented, and you must notify the provider. MAP failure. That means you were lazy that day. You got distracted. You forgot to give this person their medication. Well, we're going to write you up. You got to let us know, because that patient needed his blood pressure medication. If the medication is unavailable, why is it unavailable? Did you let anybody know that you ran out of medications? You should not be running out of these patients' medications, even if you're in an assisted living facility, because a lot of your pharmacists, the pharmacies deliver the medications to you. If they're like with VA, sometimes they deliver the medications once every 3 months. So they will send you a 90-day supply. You do not wait until day 80 to request more medications. You want to have those medications coming in advance. So you would work with your nurse to make sure that you don't have to document medication unavailable because you ran out of medication because you never contacted the pharmacy to refill the prescription. That goes with delayed prescription filling. If a doctor writes an order, you only have so many hours to get that medication. What if the pharmacy doesn't have that medication? You need to notify the doctor, because if you don't, you are actually creating a medication error. Insurance issues. When these insurance companies change, they don't always cover medications. Well, that means we have to notify the provider to get a medication that the insurance actually covers, at least until the interim. And then, of course, pharmacy issues. They may run out of opioids, narcotics. They can run out of antibiotics. So if you're having an issue with the pharmacy, let your provider know also. And so those are some additional medication errors, which would look bad if you don't follow up. So make sure that you are aware of all of those too. Our storage requirements. Medications need to be secure. Your patient should not have access to your medications, even if you're in a small assisted living facility. So all medications must be kept centrally stored in a locked cabinet, a locked cart, or a locked storage area at all times. If it's a controlled substance, let's say it's morphine, it has to be double locked. You're going to keep your medication in its original packaging. The medications must be kept in their original or legibly dispensed labeled packages. So you just can't go out and pour the Tylenol into a separate container. The Tylenol needs to stay in the Tylenol container. And then immediate return. Each client's medication must be returned to the storage unit immediately after use. So if you pull out Tylenol to administer it to the patient, whenever you're done with it, you take the Tylenol back and store it again. Medication disposal. I know this is a lot of information, but you want to be a medication aide. You want to take that next step to see if nursing's for you. So with medication disposal, medications that are expired or discontinued must be disposed, and we just can't throw them in the trash. The disposal documented on the medication destruction record. So there's actually going to be a ledger when you're writing out your medications, when you're doing your count, you're going to let us know that you threw away however many pills, but it has to be witnessed. Okay. So destruction is witnessed by another MAP, or in most instances, it's going to be witnessed with a nurse, whether it's as your LPN or your RN. And so the best practice is to, if you don't want to be throwing these medications in the toilet, is you're going to see if the pharmacy has a take back program, so that they can destroy it properly, so that it does not pollute our water system. An alternate method is to mix the medications with coffee grounds or kitty litter and water, and then dispose of them in the trash. Remember, if you just throw a whole bunch of pills away in the trash, we have people who actually go through the trash cans looking for pills. And so we don't want them to get access to these drugs. So you want to work with your nurse in your facility to figure out the best way to dispose of those medications. And guess what, you all? We have concluded part 1 of our basic medication training course. And so in our next video, which I thought I'd be able to do today, but I won't be able to do it until another day this week because I'll focus on my CNA videos later, is that I want to go ahead and cover actually the common drugs, the names of the drugs that you'd be administering, and some of the actual side effects and things you need to be looking out for. So thank you for watching. I just want to read this last part. When handling medication, it's important to keep them centrally stored in a locked cabinet, cart, or storage area. As a medication provider, aka med aide, following guidelines helps to prevent medication errors and maintain the safety of our clients. So proper medication disposal is also essential to ensure that expired or discontinued medications don't fall back into circulation and cause harm. And if you need to reach out to me, if you want more information, our website is there. It is fltraining.com. Again, this is Nurse Eunice, and I will stay around to see if you have any questions related to medication aid or the med tech programs. If you don't have any questions, I'll see you in the next video. Bye. So, does anyone have any questions?